Person-centered therapy is one of the most influential approaches in counselling. It shifted the focus of therapy away from diagnosis and technique and towards the healing power of the therapeutic relationship itself. By the end of this video, you'll be able to explain the key ideas behind person-centered therapy, describe the three conditions of empathy, congruence, and unconditional positive regard. Understand how the therapeutic relationship supports client growth. You can download our handout on person-centered therapy by scanning the QR code or clicking the link in the description. Let's start with the person behind the approach. Carl Rogers is widely recognised as the founder of person-centered therapy, originally known as client-centered therapy. He was born on January 8, 1902 in Oak Park, Illinois, in the United States, and died on February 4, 1987 in California. Rogers was an American psychologist and a key figure in the development of humanistic psychology. Humanistic psychology emphasizes the value and potential of human beings. Rather than focusing primarily on pathology or diagnosis, it centers on the capacity for growth, choice, and personal development. Rogers believed that people have an innate tendency toward growth and psychological development. In simple terms, he suggested that clients already possess the internal resources they need for change, but these resources can flourish when the right relational environment is present. So what does that environment look like? Early in his career, Rogers worked with children at the Rochester Society for the Prevention of Cruelty to Children in New York. During this time, he had an experience that significantly shaped his thinking about therapy. Rogers described how he was working with a young boy and attempting to interpret the child's behaviour to the boy's mother. She initially rejected his explanation and left the room. A short time later, she returned and began speaking openly about her own struggles. Instead of analysing or diagnosing her, Rogers simply listened. Later, reflecting on his professional development, Rogers wrote, "I was asking the question, how can I treat or cure or change this person? Now I would phrase the question in this way: how can I provide a relationship which this person may use for his own personal growth?" This shift is fundamental to person-centered therapy. The therapist is not positioned as the expert who fixes the client. Instead, the therapist offers a relationship that supports the client's own process of exploration and growth. So what makes that therapeutic relationship effective? Rogers proposed that certain therapist attitudes create the conditions for constructive change. These are known as 6 necessary and sufficient conditions for therapeutic change. But these 3 conditions or therapist attitudes are most often highlighted in training. These are empathy, congruence, and unconditional positive regard. Let's begin with empathy. Empathy in person-centered therapy is more than simply understanding someone intellectually. It involves deeply sensing another person's experience and communicating that understanding. Rogers described empathy in these words: "An empathic way of being with another person has several facets. It means entering the private perceptual world of the other and becoming thoroughly at home in it. In practice, empathy means trying to understand the client's world as they experience it. It involves listening carefully, reflecting meaning, and remaining sensitive to the client's feelings as they shift moment by moment." So how might this show up in your work with clients? You might notice it when you reflect a client's feeling in a way that helps them feel truly heard. Sometimes clients respond by going deeper into their experience because they feel understood rather than judged. The second condition is congruence. Congruence refers to the therapist being genuine and authentic in the therapeutic relationship. The therapist is not hiding behind a professional mask or presenting a false version of themselves. When a therapist is congruent, their internal experience and their outward communication are broadly aligned. They are real and transparent rather than distant or performative. This doesn't mean saying everything that comes to mind. Rather, it means being psychologically present and honest in the relationship. In practice, you might notice congruence when a therapist responds in a natural and human way rather than adopting a rigid professional role. For example, a therapist might acknowledge feeling moved by something the client has said if doing so supports the therapeutic process. Remember, you can download our handout on person-centered therapy by scanning the QR code or clicking the link in the description. The third condition is unconditional positive regard. Unconditional positive regard means offering acceptance and warmth towards the client as a person, regardless of what they share in therapy. Importantly, this does not mean approving of every behaviour. Instead, it means maintaining respect for the client's humanity while separating the person from the behaviour. In practice, you might notice unconditional positive regard when a therapist responds to difficult disclosures without judgment. The therapist communicates you are valued as a person, even when you struggle. When empathy, congruence, and unconditional positive regard are present, Rogers argued that they create a psychological climate in which growth becomes possible. Another important feature of person-centered therapy is that it is non-directive. In many therapeutic approaches, the therapist guides the session with structured techniques or tasks. In person-centered therapy, the client determines the direction of the conversation. The client decides what to talk about, what pace to move at, and what issues feel most important. The therapist's role is not to steer the client, but to facilitate exploration through understanding, acceptance, and presence. So, what might this mean in your counselling practice? You might notice that the session follows the client's concerns rather than a predetermined agenda. The therapist trusts that what the client brings is meaningful and relevant to their growth. Person-centered therapy also focuses strongly on the present moment. Past experiences are certainly acknowledged and explored when they arise. However, the emphasis is often on what the client is experiencing in the here and now, including what may be happening within the therapeutic relationship itself. The approach is often described as a growth model of therapy. Rather than simply aiming to remove symptoms, person-centered therapy focuses on supporting the client's overall psychological development. The aim is greater self-understanding, self-acceptance, and authenticity. Of course, like any therapeutic approach, person-centered therapy has also been criticised. Some critics argue that the theory is relatively light on structured techniques compared with more directive approaches. Others question Rogers' assumption that people are fundamentally oriented towards growth and constructive change. There are also debates about how easily outcomes can be measured, particularly compared with structured therapies that include specific interventions and measurable targets. However, research and clinical experience over many decades have shown that the therapeutic relationship itself is a powerful contributor to positive outcomes in counselling. And person-centered therapy places that relationship at the very heart of the work. So, to bring this together, there are a few key ideas to remember. Person-centered therapy was developed by Carl Rogers and sits within the humanistic tradition of psychology. The approach is built on the belief that people have an innate capacity for growth and self-understanding. The therapist supports this process by offering three conditions: empathy, congruence, and unconditional positive regard. The therapy is non-directive, meaning the client guides the direction of the sessions, and the quality of the therapeutic relationship is considered the central factor in facilitating change. If you're learning counselling, one useful reflection might be this: what does it mean to offer a relationship that genuinely supports the client's growth? How might empathy, authenticity, and acceptance show up in your own counselling practice? These are important questions to continue exploring, and they're often rich topics for discussion in supervision. You can download our handout on person-centered therapy by scanning the QR code or clicking the link in the description. Thank you for watching. For more counselling content, Be sure to subscribe to Counselling Tutor, and you can find more free resources on our website.